Diagnosis and treatment of CAD, coronary artery disease. Exercise tolerance test (ETT) is performed by the treadmill machine. Patient is asked to run over the machine, and the variation in the BP and ECG graph is taken to study the function and the pathology of the heart muscles. Nuclear stress test, radioactive material is injected and the variation during exercise is studied. The most non-invasive and comfortable test is echo test, which is performed by the sound wave energy which passes from the machine through the walls of the heart muscles, and over the monitor TV screen the doctor can study the interior of the heart muscles, valves, walls, thickness, and the function of the heart muscles to pump the blood through the various valves and orifices. So the internal structure of the heart is studied by this echocardiography, by means of sound wave energy. The major laboratory test is angiography, in which cardiac catheter is passed through the groin or the arm vessel in the heart and the coronary arteries, and dye is injected through this catheter, and the outermost machines of X-rays, they takes the films of the heart and all its vascular structure from every angle in the form of video and the graphic form. The X-ray films. So this is the most reliable test which is performed in the diagnosis of heart diseases, especially prior to the cardiac surgeries. CT angiography, in this, it is a semi-invasive procedure in which dye is injected into the bloodstream and the X-rays are taken from various angles from outside machines of the high-power X-ray machines. So it is a almost non-invasive type. Instead of passing catheter, we only inject the dye. Now, next is the treatment of the CAD. Coronary artery disease means there is atherosclerosis of the coronary vessels, narrowing of the vessels due to deposition of saturated fat, calcium element, and the dead debris of the cells during the inflammatory reaction of the autoimmune system of the body. Subsequently, there is narrowing of the lumen and the vessel wall, they become hard and rigid. So the blood flow is diminished according to the degree of the atherosclerosis. This leads to the ischemia of the heart muscles, that is the deficient supply of the oxygen and the nutrition to the heart muscles. So they gradually become feeble. Their function is reduced and diminished, and subsequently, when there is complete blockage of the vessel, then sudden cardiac arrest or the heart failure is in onset. So when this atheroma, which is formed in the walls of the coronary artery, that burst and they form clot, thrombus in the lumen of the vessel, coronary arteries. So there is semi or complete blockage of the flow. So subsequently the result is there is ischemia of the blood tissues, blood muscles, semi or complete, leading to the onset of the heart attack. So this atheroma, which is material formed in the walls of the vessel, when it bursts, it blocks the lumen of the vessel due to the material which is expelled in the blood stream. Almost other factors, that is platelet and the fibrin, they also adhere and increase in the bulge on the volume of this thrombus formation. That is the major cause of the heart attack. The treatment is we perform medical therapy, that is anti-hypertensive medicines are used, anti-diabetic medicines are used. In hypertension, we use beta blockers, ACE group, and calcium channel blocker medicine they are used. Metformin and similar other drugs they are used to reduce the intensity of the diabetes. Then we avoid and give psychological suggestion to the patient to adjust the depression, anxiety, and stress conditions. Then we advise the patient to do regular aerobic exercise. So when we use aspirin in the form of Loperin, clopidogrel to reduce the count of the platelet, so that the volume of the thrombi or emboli that is reduced. Anti-hypertensive medicine, beta blocker is extra, they are used. Anti-diabetics are used. And then we also advise patient to take regular, anti-acidic medicine, that is omeprazole, esomeprazole, pantoprazole. These are various groups of medicine that is used to reduce the acidity of the stomach due to the regular use of these medicines for the heart patient. Next is quit smoking. Take plenty of water, fresh veggies and fresh fruits, especially red colored fruits. They are preferred one because they consist of chemicals which are antioxidant. Various other steps and advice in medical therapy, that is the regular checkup of the person or healthy person for their BP checkup, blood sugar checkup, and the other cardiac enzyme checkup, ECG. The basic factors or the tests should be performed annually for every person which is healthy one. Now the surgical treatment, when there is Limit of the medical treatment finished, then start the option for surgical manipulations. Stent insertion during the angiography, when there is blockage in the vessels is too much, then during this procedure the surgeon also insert the suitable metallic form spring, which is called as cardiac stents, to dilate the vessel, to open up the lumen of the vessel so that the flow of the blood is maintained near about normal, so that the symptoms of the ischemia is abolished. When prior to this stent insertion or settlement of the stent, a surgeon can also perform balloon angioplasty. That is the catheter which consists of a balloon that is inflated and try to dilate the vessels so that the normal circulation is maintained. But if it is insufficient, then the next step is the stent insertion. Finally, when the more than 2 vessels are blocked or semi-blocked, then the final is the open heart surgery, that is called cabbage surgery. In this procedure, surgeon take grafts from the other arteries and vessels, veins, and then bypass that blocked area of the coronary arteries, which is diseased and suffering from atherosclerosis, that is blocked, cut away, and the normal piece of the artery or vein is stitched so that the flow of the blood is maintained. So this is a final step, and it is a very typical, very advanced and very appreciable surgical research which has been done by the human brains, especially the research surgeons, and that has saved numerous and countless hopeless lives. They have converted those patients to the normal, happy life.